Assuming you have bought and loaded the Keynote application for your iPad, here are some things to do before you are with your customer to ensure your presentation goes smoothly. First, make sure you have a nice pen handy to point at the presentation. If you touch with your finger, it will automatically advance. Set your iPad on airport mode. Extend the sleep cycle to 15 minutes. Open the Keynote presentation and have the first slide on full screen.
Hi, Dr. Harrison. Thanks for taking the time to meet with me. Today I'm going to provide you with a brief overview of our new colon cancer signature test, ColoPrint. As you know better than anyone, Dr. Harrison, when it comes to stage 2 colon cancer patients, treatment decisions have been unclear. Something like driving in the fog. If you could get definitive risk assessment for every stage 2 patient, would that make the road ahead clear for you and your patients? That's the benefit of our new ColoPrint signature. It goes beyond clinical factors to clearly stratify all patients.
Every patient?
Yes, into high and low risk, providing you with 100% actionable results, as well as enables all of your patients to embrace their decision to undergo chemotherapy or not with confidence. ColoPrint is an objective gene expression signature developed through an unbiased analysis of the entire human genome. Agendia had access to untreated tumor samples with 10-year patient follow-up. The signature development process began by identifying 2 patient groups: those who developed distant metastasis within 5 years and those who were cancer-free at 5 years. The entire human genome was analyzed for both groups, and genes with the strongest correlation to relapse were identified. The resulting difference in gene expression pattern was captured in an 18-gene signature, ColoPrint. ColoPrint was validated in public data sets and in 3 independent clinical studies in Barcelona, Munich, Val d'Hebron, and additional ongoing studies include a 4th independent validation study with approximately 200 patients from MD Anderson stage 2 and 3, as well as PARSC, a prospective study with 34 participating sites in the US, Asia, and Europe. 17 sites currently enroll patients in the US, with enrollment expected to conclude at the end of 2012. ColoPrint identifies a patient's risk of distant or local regional relapse and stratifies approximately 2/3 of patients as low risk, while 1/3 of patients are classified as high risk, as you might expect based on current clinical factors. High-risk patients have a 20% risk of relapse in 3 years, or a 1 in 5 risk of relapse, while low-risk patients have an 8% risk of relapse in 3 years, or 1 in 13 risk. While clinical risk factors determine the risk in approximately 30% of patients, with T4 being a known poor prognostic factor and MSI high a recognized good prognostic factor, it leaves a large number of patients in a gray indeterminate risk group. ColoPrint clearly stratifies all stage 2 patients, eliminating the indeterminate group or gray area. Even when we remove the strong prognostic factors and analyze the T3 MSS phenotype group, ColoPrint is still clinically significant, as seen in this univariate analysis. While none of the other clinical factors have significant prognostic value, ColoPrint clearly separates this indeterminate subgroup into 2 groups. The combination of ColoPrint and clinical risk factors further personalizes the estimate of a patient's risk of relapse. Patients with a low-risk ColoPrint result and no clinical high-risk factors have an estimated 5% risk of relapse in 3 years, while patients who are ColoPrint high-risk and have at least 1 clinical high-risk factor have an estimated 22% risk of experiencing a relapse within 3 years. The hazard ratio is based on a univariate analysis, meaning all the groups were compared to the low-risk group With a hazard ratio of 5.04, we see that the high group has a 5 times higher risk for relapse than the low group. So, if there's one thing that I want you to remember about Coloprint, is that unlike current clinical risk factors, Coloprint provides definitive stratification for your patients.
Yep.
The Coloprint report was designed to assist you in having the very difficult discussion with your patient regarding their treatment. By eliminating the indeterminate results, Coloprint reduces uncertainty, enabling both you and your patient to embrace their individualized treatment plan with confidence. Coloprint, combined with clinicopathologic factors and MSI, significantly improves prognostic accuracy, thereby facilitating the identification of patients at high risk who may be considered for additional treatment. Dr. Tabernero and the ASCO post this year probably summarizes this better. So, doctor, based upon our conversation about Coloprint and assessing your current patient population, is there one that comes to mind where this information would have been beneficial?
I was just thinking about a patient that I think the Coloprint signature would bring tremendous value to my helping with treatment decision.
Okay, excellent. When is this patient scheduled?
You know, we'll have to check the calendar, but I'm pretty sure it's Wednesday morning, so it's coming right up here.
So, if possible, what I'd like to do is coordinate with you and pathology to make this test available. Are you free this afternoon?
Let's do it. You know, we should probably talk to the oncologist as well that I refer most of my patients to, though, so he's familiar with the results when the results come in.
Absolutely.
Okay.
Well, excellent. Thanks so much for your time today. I appreciate it.